everyone, this is Harshita. Welcome to Teddy Guides You channel. So in the last class we dealt about the basic circulatory system and layers of the heart and cardiac failure. So today in this class we are going to discuss some of the special topics which are very important for your NEET preparation. So first one is special strains for myocardial infarction. So what do you mean by special strains? For example, I have given you a normal heart and the heart which is affected with the myocardial infarction. And I told you to keep it in triphenyl tetrazolium chloride solution. Okay? So if the heart becomes red in color, then it is a normal heart. If the heart becomes yellow or pale color, then it is the heart which is affected by the myocardial infarction. Why? There is change in the color of the heart because it is due to the LDH activity. Normal heart will possess the LDH activity, so it is brick red in color. But the heart which is affected by the myocardial infarction has no LDH activity. Okay, hence the area will get infarct and it will become yellow or pale in color. Okay, so this is the thing you should understand regarding strains. Next one is complications. So there are different types of complications in myocardial infarction. And the hint that you can remember is A, C, T, R, A, P, P. Okay. So this is the mnemonic that you can remember. Okay. So A for aneurysm, C for contractile dysfunction, T for thrombosis or thromboembolism, R for rupture, A for arrhythmias, P for papillary muscle dysfunction, and D for Dressler's syndrome. Dressler's syndrome is an autoimmune fibrosis pericarditis. In this, the heart will get affected after 2 to 3 days or after a week of myocardial infarction. So these are the complications that you must remember. So next one is ischemia reperfusion injury. Okay. So first let's try to understand the name. Ischemia. What do you mean by ischemia? The heart is not able to get enough supply of blood. Reperfusion. Now the heart is getting enough supply of blood. Injury. The heart is getting injury because it is again getting enough amount of blood. Okay. This is done because of bypass surgery. Okay. For example, a heart is affected with myocardial infarction or ischemic condition. We have done bypass surgery to the heart. Okay. Again, there is a rush of blood. Due to this rush of blood, there is high calcium supply and high oxygen supply. Okay. High calcium supply will leads to the hypercontracting muscle fibers and high oxygen supply leads to free radical function. Okay. In the first case, it leads to contraction band necrosis, and in the free radical state, it can damage the myocytes, means the cells of the muscle. Okay. So this is ischemia reperfusion injury. And next we move to carditis. Okay. Itis means inflammation. There is inflammation in the heart. Which part of the heart is getting inflamed? Means pericarditis, myocarditis, and endocarditis. These are the layers of the heart. In the first class, I dealt with the layers of the heart. If you not yet seen it, please go back and see the part 1 video. Okay. In this, the heart is getting inflamed. Which part? It may be pericarditis, myocarditis, and endocarditis. Okay. So let's discuss about the endocarditis. In this endocarditis, there is an inflammation in the endocardium layer of the heart. Okay. Here we can see 4 different conditions. First one is rheumatic heart failure. Second one is infective endocarditis. Third one is non-bacterial thrombotic endocarditis, and the last one is Lipsman sac endocarditis. These are the four conditions in which we can see endocarditis. Okay, and it leads to vegetations, means there will be accumulation of the substances along the line of walls in the heart. Okay, so these are the vegetations, and the pattern of vegetations changes in these endocarditis. Okay, so let's discuss about the first one, myocardial infarction. Okay, sorry, rheumatic heart disease. Okay, in this rheumatic heart disease, in this rheumatic heart disease, age is very important, which is 5 to 15 years of children are getting due to this rheumatic heart disease, which is caused by the beta hemolytic streptococci organism. Okay, if a child is coming to the OP, he will present with the sore throat. After 2 or 3 weeks of infected by the beta hemolytic streptococci, the person will acquire a sore throat condition. Okay, not only sore throat, it also affects the multiple systems. Okay. So multiple system is, let's see. There are diagnostic criteria for there. First one is major criteria and the second one is minor criteria. Major criteria, there will be migratory polyarthritis. Okay. Second one is pancarditis. Third one is subcutaneous nodules. Fourth one is erythema marginatum. Fifth one is Sydenham's chorea. So these are the major criteria we can observe in the rheumatic heart failure. And the minor criteria include fever, arthralgia, or prolongation of the or increase of the CPR, ESR, PR. Okay, these compounds may increase, and there will be another evidences, supportive evidences for this rheumatic heart failure. These are raised ASO titer or positive throat cell. Okay, so these are the major and minor conditions you must remember. And let's move into the strains. So there are five strains for this rheumatic heart failure. Strain number 1, 3, 5, 6, and 18. How to remember this? 1, 3, 5 are the odd numbers, and 6, 3 is 18. So these are the strains to remember. Next, let's move to the pathogenesis. Like what is happening in the heart so that we are getting rheumatic heart failure. So it is a type 2 hypersensitivity reaction. So type 2 means it is antibody mediated. Okay. So this streptococcal M protein, it cross reacts with the glycoprotein. So there is a glycoprotein which is present on the heart. This glycoprotein is getting reacted with the streptococcal M protein. Okay, and it leads to the molecular mimicry. Okay, due to this molecular mimicry, we will get mitral regurgitation and mitral stenosis. Okay, the most affected wall is mitral wall, and the less affected wall is pulmonary wall. So this is the pathogenesis that you must remember in case of rheumatic heart disease. Okay, in this you can see pancarditis. Pancarditis means all the layers are getting affected. So first one is pericarditis. In this pericarditis, there are constitution of two layers. Okay, so in between the two layers there will be accumulation of fibrous tissue. So between the two layers of the pericarditis, I'm telling you again, if you not yet seen the part 1 video, please go back and see the part 1, because in that I dealt very clearly about the layers of the heart. So between the two layers of the pericarditis there will be accumulation of fibrous tissue. So it leads to bread and butter appearance, hence it is called as bread and butter pericarditis. Next one is myocarditis. In this myocarditis we can clearly observe Ashkoff's body. Ashkoff's body, the composition is very important. First one is fibrinous necrosis, there will be necrosis, there will be inflammatory cells, and there will be Anitkoff cells. Okay, so there will be presence of these three in the Ashkoff's body. So what are these Anishkoff cells? Anishkoff cells are nothing but the macrophages, but the nucleus of the macrophages is very different. First one is the nucleus may be slender, wavy, ribbon like. Okay, so these are seen in macrophages. So this is all for today. In the next class we will continue the remaining chapter, and the next class is going to be the last chapter in this cardiovascular system. Okay, so I hope you enjoy the class. If you have any doubts, let me know in the comment section. If you're not a subscribe to the channel, please consider subscribe to the channel dedicates you. This is K Harshita signing off. Thank you so much.